Okay, everyone, we're going to go ahead and get started. Thank you for being so patient, and thank you for joining us this afternoon. My name is Alexis, and I am the Community Manager for U Online. As we get started today, I just want to highlight a few points. We'll run about 20 to 25 minutes, and we'll make a recording of this session available to all attendees after we end, so you can view it at your leisure. And we do invite you to ask questions throughout the lecture. We want to give you the best information possible. So if you see the question box on your control panel, you can type any comments or questions right in there, and we will receive them. In addition, Dr. Giroux will have some questions for you at the end of her lesson regarding your own experiences with healthcare practitioners. So we invite you to participate by using the questions box and sharing your feedback. To kick it off, we are interested in our audience, so if you happen to be in the healthcare field, go ahead and use that questions box and let us know what you do. I'll also invite you to join the conversation on Twitter, and feel free to use the hashtag UOnlineCom. With that, I will turn it over to Dr. Giroux, who will be leading today's discussion.
Good afternoon. I hope you have your lunch with you because this is going to be very interesting to eat and listen to. Okay, I am Valerie Mano-Giroux. I am a professor at the University of Miami, and I have been for 25 years. I actually got my master's in the School of Communication and then went on for my PhD in educational leadership in the School of Education. And once you're at the University of Miami, you do not want to leave, so that's why I'm still here teaching. But it never gets dull because there's always something new coming along, like this online courses that we've established for our master's program. For those, I'm going to be teaching two courses, one in interpersonal communication that we're talking about today, and the other one in gender issues and leadership. I chose the interpersonal communication class because I think that it's an interesting topic. It affects us all in our everyday lives. And the interpersonal relationships that affect our lives last like a whole lifespan. So we cover topics like that in interpersonal communication, communication through our lifespan, communication with family, with romantic partners, and even with people we work with. Today, one of my favorite articles from the textbook that I use is Interpersonal Communication in Healthcare, written by Thompson, Robinson, and Brashers. For the course, I chose a textbook that has pretty much the articles are written mostly by the most prominent people in the field. So it gives us a good taste for the research that's out there. So with today's research, what I'm going to be talking about with healthcare is communication between the healthcare provider and receiver. There's lots of other areas in healthcare communication, the health team, between the communication between the doctors and nurses, communication between the technicians and the nurses. So there's like, it just goes on, along with, of course, administration. But for interpersonal communication and the topic we're covering today, this involves us throughout our life, and our conversations with our doctors can be a matter of life and death. So it's really important to understand the communication that's going on and the conversation that's taking place between you and your healthcare provider. I don't mean to sound dramatic with the life and death thing, but just think about there are so many variables that affect the dialogue and the outcome for both the patient and provider. A lot of the research focuses on provider-patient dyads, and when you're ill and talking to your doctor, you have a million questions and so much uncertainty. They're asking you questions, you're asking them questions, and there's that whole disclosure process. That's important on both sides when you think about it. because the more open you are with your healthcare provider, the more accurate the prognosis can be. So well, we're going to look at the examination of areas such as competence and incompetence on the part of the healthcare provider and ourselves as the patients. But in this article, we also look at end-of-life discussions and found that everyone should be involved, not just a family member and not the patient, or not just the patient and not the family member. There's a whole situation going on here where you have to have lots of support and teamwork. So the patient, because it's so important, is often the focus of research in this area. And co-participation, as I said, is really important in the discussions, not just the discussions, but also the decisions. So the patient's assertiveness is looked at. Some folks are still in the mind frame that whatever the doctor says is law, and they don't have any choice, and they just have to go along with the diagnosis and the medications prescribed. However, if you think about it, who knows your body better than you do, right? And that's why full disclosure is so important. And tell the doctor not just your symptoms, but how you feel about this prognosis and treatments. You know, we have access to the internet for information. And not only that, we're bombarded with advertisements from drug companies on television all the time. So, of course, this information that we research on the internet and what we learn from these advertisements don't replace a medical degree and the expertise that they have. But it really does improve the patient's knowledge of this disease that they have and what's out there to help them. So the other side of the coin is we hope the doctor's listening to the patient's concerns along with the symptoms. This provider empathy is essential in any discussion. It provides the patient with satisfaction, and that's one of the most important outcomes from this communication between patient and physician. It's also important to listen carefully what the doctor says about your healthcare situation. Sometimes we don't totally understand what he or she is telling us. You know, it's hard to have full comprehension and attention when they just told you that you have maybe a life-threatening disease and your head is just buzzing at that point. But it's important to try and pay attention to what they're saying, and if necessary, bring a family member with you so that there's more than one of you listening to this information from the doctor. Sometimes you just don't hear stuff or you don't understand it. And sometimes, you know, the words they use, they're using professional jargon and they think you understand them, and you have, like, you're kind of clueless, but you don't want to say anything. That's why it's important to speak up if you don't get it. If you understand your disease, you understand the medications, you understand what's going on, it totally improves your motivation to fight this disease. And they found in the research that it also improves your psychological experience that's going on. Because to motivate you to fight and to give you that hope, all of this brings about almost a sense of well-being. I can do this. I can punch cancer in the nose. I'm not, taking this sitting down. I'm going to fight it with everything I got. And that positive experience is what makes all the difference. And by discussing the symptoms that you even get from the medication is important, because you can be symptom-free, but the medication is causing you more symptoms. What they're looking for in research very often, and this is the research from the medical people, is that they're looking for quality of life. Not only do they want to help you get over this disease, but they also want to make sure that you have quality of life, which is that you can keep doing everything you did on a daily basis. Even during chemo, you can keep going to work. Even during radiation, you can, get into the office. And you might have side effects and be somewhat uncomfortable, but you know what to expect, and you can gear your day around it so that you are not totally incapacitated or sitting home in a rocking chair, feeling sorry for yourself. Like, you got to fight it. You got to be tough, and the way to fight it is to know through communication what's out there to help you. The effects are amazing when you have this this fighter instinct. It's fight or flight. We're going to do the fight instinct. We're going to tap into that. The survival rate goes up. Through cooperative healthcare, there's less hospitalization. The results can actually be dramatic. They can, lead to a total cure. It's nothing better than to get a PET scan and saying there's nothing left in you. You're fine. You are cancer-free. So, and you go, ha-ha, and I did it myself. Well, with a little help of you guys too, of course. But your medical team is there for you, and that's just what they are. So you're part of the team. That's what you got to realize. So, you gotta not suffer in silence if you are getting symptoms or if you're not feeling well. We have secure healthcare sites, so now we can send emails to those healthcare sites. We can look at our medical records. You can look at a medical test that was done the day before. And then when you see the results of the medical test, you're going to have questions for your physician or your healthcare provider. So you email them and find out what those test results mean. Very often they'll give you a call on the phone, even at night. After their office hours, they'll give you a call because you are creating a direct contact. But if you don't contact the doctor, they're not going to know that you're sitting home suffering or you're worried about what that result said, because sometimes the jargon they use when they're telling, explaining what happened with your test is it's confusing. So being able to email your doctor directly is important. And they found in research that the doctors also think it's a great idea because it keeps them on top of their patients, and it leads to better health care. So participating, there's nothing but benefit to participating in healthcare decisions. And as I said, it also benefits the physician. So they understand what's going on with the patient. They also get high ratings because, they always send us those questionnaires after to find out how our experience was with our healthcare providers. And, they want 5s. They want to go the best, excellent healthcare that they can provide. So patient satisfaction really increases, as well as patient retention. They want to keep you coming back. Not that they want you sick all the time, but they just, if something happens, you return to them because they know you and they're getting to know your body and your health and your whole situation. So also, another benefit for the physician is that it's a reduction in malpractice suits. And that's something we'll talk about a little later too. So just think about all the benefits or the outcomes that result from our communication with our healthcare provider. What else? So that we talked about patient satisfaction. Also, you have adherence and compliance to physician's instructions, total overall cooperation of the patient if you understand what's going on. So that improves your health status, your quality of life, and as I said, reduces those malpractice suits. Patient satisfaction in the communication studies are a result of both verbal, as we've been talking about, but also nonverbal communication. You really can't separate the two, verbal and nonverbal communication. Patient's satisfaction is often judged on the warmth and openness of this communication between the physician and the patient. You look at certain things in nonverbal communication. You look, there's immediacy. This is a subject that is studied in nonverbal communication by a researcher named Mehrabian. And what you look for in immediacy is the forward lean and the eye contact and the nodding, making sure that they are listening to you and you're looking at them. There's a mutual gaze going on, not the physician turned around with his back to you, typing on the computer. So it doesn't work that way. So that there's the warmth in their vocalics too. But there's interesting research that resulted in, they call it muted speaking, that it almost sounds like somebody talking through a wall. But when so you're listening that way, not to the words, but to the tone. And the tone, if the physician's tone of voice is angry, the satisfaction of the patient goes up. It's like the physician is as angry at this disease as you are. And as I said, that's we're going to fight together. You know, it's kind of like a coach telling you to, you know, we got to go out there and do this, and we're going to do this play and that play, and that's how it, you know, you're going to get better when we do this. So, let's see, what else did I want to tell you about that? So with the nonverbal communication, also the volume that they speak at and the how fast they speak. So if they are going too fast and you can't understand them, they can see by looking at your face and looking at your nonverbal that you are you're not totally getting it, you're not understanding it, because sometimes we present our emotions without even realizing it. You're going, how did he know what the heck he was talking about? So, but if they can decode your nonverbal, that also helps in this communication. So you can see the difference between someone flipping through a chart while explaining a procedure and someone who is really talking to you. I actually had a doctor who designed on the flip chart what was going on with my body and what the surgery was going to do, and he drew the body parts and was working really hard, and these visuals are also important. What happened then was my husband arrived late for this appointment, and I had already folded up my little flip chart paper and put it away. So he just started drawing another one. I said, here, I have it. And he goes, no, 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 I'll do this for your husband too. And he went through the whole thing over again, drawing the pictures. So this is like really positive demeanor. And we you know, we were positive going into surgery because we know what a caring person he was. So that's all part of nonverbal communication too. Sometimes our doctors, well, mine drew a diagram. Sometimes they have a model or a poster to help clarify information. All of this nonverbal immediacy really helps relax the situation between patient and doctor. So it's important, as I said, that for you to be open with your doctor, with your side of the communication, your questions. And if your doctor's back is to you while he's busy typing or not looking at you, you're going to not really be as open with him about your symptoms. So you start feeling more like a body part or a disease than a person, when they're just like not even looking at you or really paying attention to you. And that's at least somebody who's asking questions. But, you know, there's the other paternalistic doctors that sit down, tell you your diagnosis and say, this is what we're going to do. And That's it. Then they go out of the room to the next patient. So but medicine in the new millennium is getting away from that. They understand the power of the conversation, and that the patient has to take part in the decision-making process, because after all, it's affecting us, our lives, and of course it also affects our family. So there's a lot going on there, and the importance of communication cannot be minimized. So they call this the self-determination theory, because humans have three basic psychological needs. Autonomy. They want to feel that they are important of themselves. That's the autonomy. But they also want to feel relatedness to the other people, and they also want to feel competent. It's through patient-centered care that the physician is autonomy supportive rather than controlling. The paternalistic is telling us what to do. But with patient-centered care, it's totally different. The healthcare provider, that way, the healthcare provider is showing high levels of the relatedness that we're looking for through this conversation. And the patients can feel free to ask more questions, seek more information, express worry, and also assert rights and beliefs, because sometimes things they go against religious beliefs even. So then you have to work through that. Also, there's that other area where if you are not, your English is your second language, you may not understand something. And just think how important that is to understand, like, how to do the medication and what those words mean. So, if you need a translator, one should be provided for you. If you just don't understand what you're supposed to do. Because think of the damage and the danger of taking your medication incorrectly. So all of that is so important. So we talked about relation-based care, joint decision-making, being of a shared mind, so important. And of course, having better understanding both on the part of the physician and on the part of the patient, right? And all of this, you're establishing rapport with your doctor. And that rapport, as I said, gives you that confidence in his or her abilities, especially if you're going into surgery for something, right? Or they're taking care of your child. You want as much information as possible. It's also important for the physician to be positive in that perspective, so that this is so important. This is what is, very often, I know at Sylvester Cancer Center, we have a whole cancer team, and they talk about you at a meeting in your case on every Thursday morning. That's where they are. They're talking about, and sometimes you have a very interesting case. So you're covered by your radiologist, your chemotherapy doctor, your surgeon, your primary care physician. Everybody is kept in the loop. So this is like a whole team. And your physician assistant, she or he is your right hand many times, because she's the one that you send those emails to and complain like crazy, and sometimes she'll refer it to the doctor or check with the doctor, or now with the secure sites you can go to the doctor yourself or address the team if you needed to, if things weren't going right. But just think about the power of that. Cancer patients seem to be more involved than regular patients with their health care. So if you're a cancer patient and you don't want to lose your hair, there are other drugs out there that don't have that side effect that could be considered. Because you want to keep working, and you don't want to wear wigs and scarves to work. So, isn't there something else out there? But then they can put that drug on the table and say, this is the name for you. And they give you sheets with each of the chemos that they're going to use on your cancer. And and they tell you the contraindications, how it's going to affect you, and you can look them up online. And then you can see if there are alternatives. And then if they do give you an alternative, you can look that up online and see which is usually used to target your type of cancer. So there's beyond that, then there's support groups. Because after the chemotherapy, you have side effects. You're tired. You can't get up off the couch. So what are we going to do about that? So they prescribe physical therapy. So now you got somebody else in the team. So you've got a physical therapist helping you as well. So between the printed materials and reading it over and looking up how these drugs, it all makes sense in your head after it. And the information is so important. Let's see, what else we want to talk about? Oh, mutual gaze is important, as I said, in the nonverbal area. And when the physician is looking at the medical, say your x-ray, and talking to you about it, your gaze also goes to that x-ray. So there's the cue that you see from that eye contact to moving to the screen, and you do the same thing. So this also gives you the feeling of being in sync with the doctor. So he's presenting this information to you, so you have it, and it's nothing mysterious with the computer. You only see is the back to the computer, and he's looking at it. Much better when you can share this stuff. Some of the information out there has research on physicians' decoding skills, and some of it is important, and it's interesting in that they found that medical students had the worst nonverbal decoding skills than any of the subjects that they had in their study. Any of the undergraduates, and particularly those who did not study science, were better than the medical students. And the medical students in specialized areas had worse decoding skills than those interested in primary care. So you can see how it's important to sharpen these skills. So they actually have classes now being established for the physician and the patient to improve communication. The classes are being held, and they are, I think they even started them at Sylvester Cancer Center, so to improve the physician's nonverbal skills or just communication skills, as well as the patient's. So everybody is comfortable in this, what would be the most uncomfortable situation in your life. So establishing the rapport is important. Results in sharing that information and creating positive talk is important, because what we're doing is creating a partnership between you and your healthcare providers, which results in lower expenditures for diagnostic tests and very often less hospitalization. End-of-life discussions are also something taken a look at in research, and that is interesting because in the United States we don't like to deal with death. Think about all the euphemisms we have for death: passing away, moving on, going to a better place. So the end-of-life meetings are really important. They're an important issue, and they usually don't involve the patient. It's important decisions like removing breathing equipment, or transferring to a nursing home, or starting hospice care. At times, families even disregard the patient's advance directives, such as DNR, do not resuscitate. All of this is really important because the patient is the center of all this situation. So And they found that sometimes family doesn't want to talk about this stuff. They don't want to deal with the end-of-life issues, you know, keep them on the tubing for the rest of their days. But is that, you know, what's best for the patient? You got to remember the whole family is affected by a health crisis. It should be a three-way conversation between the healthcare provider, the patient, and the family. It's been found through research that families that don't want to talk about it are the ones that have a harder time coping with the whole situation and dealing with it. So from the physician's perspective, another difficult conversation is, as I said before, disclosure of medical errors. These are usually result in profound legal ramifications. That's why, you know, there's the accountability and the restitution that follows, not to mention the caregiver's reputation. It's suggested for the physician that honest disclosure is important, definitely an apology and an offer to make amends. In addition, research indicates that the doctor should publish in a medical journal so that it doesn't happen again. This way others can learn from the mistake. And that's a pretty serious idea for someone who has made a medical error, which could be making someone really ill, or it can even result to end of life or death. But just think about how much we have in front of us with the digital age, all the medical information that's available. Our medical records are online, medical test results are available. We can look up symptoms and ailments on health websites. And there are also online support groups. And online support groups are really helpful. Of course, there's face-to-face support groups too. But think about the online. We can email each other. We can have chat sessions. We can have live chat. We can, you know, have delayed chat, asynchronous chat going on, keeping a chat room open for people who are suffering a disease and going through symptoms. And the discussions on the online support groups are often what medications were recommended. Oh yeah, that happened to me, so my doctor prescribed such and such and it helped a lot. Or, oh no, my doctor prescribed that and I felt sick for 3 days. And so, you know, these are things that go back and forth, and they're important. These are other people who are suffering the same, in the same situation you are. So the digital age is so important. We already talked about the time-saving emails and the better care that results from them, and the immediate benefit to the patient of getting a call that night or an immediate appointment instead of having to wait until your annual exam to consult with a physician. So the healthcare research area is grounded in lots of different theories. I talked about Moravians and a couple others during the session. But the application of these theories is what is so rich and fascinating, and how imperative it is and pertinent to our lives. The final words in this article were concerning, it sums up the importance of the effective communication in healthcare. The process of communication is similar to that found in many settings, but the subtleties and the consequences are distinctive and inimitable. So that closed the chapter and that closed my session, but now I'd like to address any questions you may have regarding interpersonal communication in healthcare. I hope I made myself clear and you understood what this chapter is about. So if something wasn't, just type up a question and we'll get back to you.
Thanks, Dr. Giroux. That was great information. We did have one question regarding how the age of the patient can affect the communication between the practitioner or doctor and the patient.
Okay, age is really important, is an important factor. That would fall into nonverbal communication as well, the age of the patient. But usually, well, think about a child. If a child is suffering, if this child is suffering from cancer, the patient is, you know, sitting there and the parent is there, and very often the physician is talking straight to the parent and not even addressing the child. The same thing happens with the elderly. Yeah, the elderly are maybe sitting in the wheelchair, and the physician and the caregiver or the relative are standing there talking over the person's head as opposed to the person. So think about what the physician can do in this case, which is, you know, kneeling down and talking to the patient and considering her in this diagnosis and talking to her about it, him or her, of course, and addressing the child and saying, do you understand that? Kids understand a lot more than we give them credit for. So involving them in the conversation and as part of this partnership is really important. With the post studies or the support, cancer support groups, there are great things out there for the younger patient that can be recommended by the physician. There is a pediatric oncology program that has special meetings for the children. It also who are suffering from the cancer, but it also has special meetings for their siblings, their brothers and sisters, and what they're going through, and letting them talk about it as well. As I said, disease involves the whole family, but you can't treat the child or the elderly patient as a non-person, talking as if they didn't exist. And that's really important. And the Cancer Support Group also has meetings for parents dealing with their child with cancer. So there's so many support groups out there. There's yoga, there's yoga classes, there's Pilates, there's diet classes, changing your diet or what you should eat or what you can eat. It just goes on forever. So there's lots to be shared from the physician. It just doesn't end from when you leave the doctor's office. There's so much more because it's affecting your whole life.
Great. Thanks so much, Dr. Drew. That's really great information. So right before we wrap up, I just wanted to encourage all attendees today to consider our Masters in Communication program. You got a little taste of what you'll be learning in the program with Dr. Giroux. It's one of the many courses that we offer. Our application for our May class is due on April 18th, so you've still got about 2.5 weeks to submit that. And if you do not have, the ability to begin in May, we also offer an intake in September and January. So I encourage you to follow us on social media, check out the websites listed in front of you, and of course reach out to an advisor with that email address right there with any questions, onlineinfo@miami.edu. Thanks for everyone for sharing your lunch break with us, and thank you, Dr. Giroux, for the wonderful information.
Thank you. Bye-bye now.